Okay. Happy Friday. Welcome to the Mental Health Parity Advisory Committee meeting. Today is Friday, March the 22nd, 2024, and we are going to get started with the meeting. I'll start with introduction and roll call. Carly Fleech, Melissa Salazar, Dr. Fowles, Carrie Steving, Kathy Busby,
Here.
Monica Curry.
Here.
Dr. Wilson, I see you on. I don't know if you can, I'm trying to make you a panelist, but I do see that you are here and present. Mr. Thompson.
Here.
Nicole Porter. And Bonicia Hill.
I'm here.
Wonderful. Thank you guys for taking time out of your day to be a part of the meeting today. I am navigating both the webinar and the screen share, so bear with me for a moment. I'm going to pull up the agenda so you can see what we are going to do today. Okay. Can everyone see the agenda? Yes. Yes. Okay. I want to take a moment to introduce, I know she couldn't make it the last time and she was just jumping in, but our new assistant director is here, which many of you know that she's the new Erin. And I want to give Gio a time to say some words and introduce herself and welcome her to our committee meeting and to our call.
Good morning, everyone. First, I'd like to apologize. The last time I actually jumped on to observe, and then I was asked to speak, so that was a little bit out of my element at the time. Thank you to the committee members and other participants for being on the call. I realize it's been a very busy week for us in insurance and other matters in insurance that everybody's paying special attention to. So I'm happy we have this opportunity to meet on a very important topic. I'm hopeful that you'll find some of the things that Dr. Hennigan has to share important and on topic. And likewise, at the end, we would love to hear any suggestions or feedback for future meetings as well. So I will go ahead and pass it back to Lynette. And again, thank you all for joining us.
Thank you, Gio. Our media update, our working group had some conflicts trying to get together this past couple weeks. And so we are starting to dissect the webpage, the Mental Health Parity webpage. We've gotten feedback about the FAQs, going through them to see what FAQs are relevant, which ones we need to update or refresh, or do we need to add some new ones? So that is what we are tackling at the moment. We also have some new IT staff in-house here at the department, and so working with them to try to get things aligned and sent over to them so we can start updating the webpage. And when those updates start to happen in real time, I will send out an email on communication so you can start checking it out and what's changing, what's happening. There's still room on the committee, so if you want to be on the working group to help update the website and communication, feel free to shoot me an email and I will include you in the next invite when we do meet. I don't know, Vista or Benicia, who are on the committee, on the working group right now, if you guys have anything to add or want to share anything. I know that we're trying to tackle it in baby steps.
Nothing at this time. I look forward to working on it.
Okay. Joshua Segmeyer didn't have any updates this month from Access and ADHS, so we don't have any program updates or anything on the crisis system at this time. So we will move on to the mental health parity report update, which it's kind of exciting for me because we're digging in. And let me share. Hold on, let me see how to switch sharing and Bear with me. We will get there. Okay. Can everyone see that?
Yes, it's on there.
Okay.
Can I ask a quick question first? I have somebody from my office who's trying to, participate as an observer. And she's telling me, she said, I see the panelists listed, but it says it's waiting for the webcast to start. Is there anybody else on that is not a panelist? I'm wondering if there's,
Yes, we have
okay,
quite a few people that are, they're called attendees if they're not panelists. And we have quite a few attendees on.
okay. Then it must be just her side. I don't know if maybe you can put I didn't want to send my panelist link because it's a password thing, but if you could have opportunity to put in the chat so I could send to her the link for the observer link, I'd appreciate it. I know you're doing multiple things.
Okay. We can multitask.
Yeah. Yeah, what she says is it says waiting for the webcast to start.
That should do it.
Okay, thank you.
You're welcome. So we have, or I have started doing some of the analyses of what we have received. And I can't disclose which ones I have completed yet, but so far the ones I have completed, we've noticed some trends that I wanted to share what we're finding. And I can safely say at this point, there hasn't been anything that has risen to the level where we need to do any type of corrective action as of yet. So that's a good thing. And I think it's been a really good learning experience. The individuals we have talked to and that we've been working with, kind of doing in tandem and in collaboration, because we're all learning together. I know I'm learning, and I know this is the first time that the industry has had to submit the trainer report. So it's been a good learning experience on both sides. I will say that. So one of the trends is there's lumping together of the NQTLs. And the common one seems to be prior auth and concurrent review, which they're so close together. I can understand why they would get lumped together. But each NQTL has to remain separate. It can't be lumped together. They're their own separate NQTL. So that's one of the first ones that we saw as a trend. Also, definition clarity. And this one is, so in the example, they said the complexity of condition will trigger a concurrent review, but it did not give a definition of what the complexity of the condition, like what's the threshold for that. It wasn't clearly defined to say, oh, this is what, when the complexity reaches, whether doing a number scale, when it reaches a 7, or when, if they're using a certain valid tool, when it hits this marker. It just was very vague. So we couldn't tell what would trigger the complexity of the condition. What does that mean? And so being very clear on the definitions in the analysis so it's very clear on how we can define that. And I will say for this particular one, they didn't define it on either side. So it wasn't defined for mental health substance abuse, and it was not defined for med-surg either. So we asked them to go back and to define that. The next one was not showing the analysis. So they would write up the report and say, and so we did the analysis and our finding is X, but there was no analysis for us to look at to see how they got to X. So making sure that you're actually showing the actual analysis in the report. And then the final one is combining analysis. And again, prior authorization, concurrent review, and retrospective review seem to be the most common ones that are lumped together. So they also lump the analysis together. So instead of each analysis has to be separate as well with the NQTL. And so if you have 3 NQTLs, you need 3 separate analyses and not just one big one for all 3. I hope that clarifies that. But that's so far what we've seen. Again, nothing tremendously egregious, and more so a learning curve, I believe. So when we've explained it to those individuals, they were clear and able to fix it. So it's been good. I don't know if anyone has any questions about the trends. No. Oh. No. Trying to figure out how to stop sharing to go to the next one. So
Thank you for everyone's patience. Dr. Hennigan is actually, this is her first meeting where she's handling the different responsibilities of this meeting on her own. So we appreciate your patience.
yes, thank you for your patience.
I think if you stop sharing generally, using the stop sharing function and then determine what you want to share again and just do it over again.
Right. I can't find it was up here, but the stop sharing has disappeared.
If you shrink your screen, it should give you the option on the WebEx menu. So if you click below at the WebEx menu next to the PowerPoint on the bottom, this is what you wanted anyway, correct?
Yeah.
Okay. Okay.
And for the next thing is so we have the triennial report, and then we have the annual mental health parity report. Some of the industry remember that it is also due on March 15th, annually every year. And then it's the big one that's due every 3rd year. So just if anyone hasn't submitted that's listening from the industry, please remember to submit those. It was due March 15th. Again, some people did remember, and it's just signing the attestation that nothing substantially has changed, and you file it into SERV. And for those that have done this, you know what the process is. So I don't know if there's any questions on that. Okay. So for upcoming federal updates, as of right now, there isn't any substantial changes to the legislation federally. I know that it's moving through probably very slowly as this is an election year, and so I'm sure that their attention is divided with other things. But there is a training that I want to share. It's And stop sharing this.
We'll definitely have to get this ironed out for you.
Yes. It gave it to me before, and that's why I'm like,
And then if you could also share with us, once you've done that too, any pending litigation that could have impact on the NQTLs. I think you have some updates on that as well from the
Yes.
local perspective.
let's see, this will do it. I'm getting everything except for what I need.
I think if you drag the information just over to the screen where you have the agenda open, it would just automatically be there. I don't know if it's that sophisticated to where it would just take over from there.
I do apologize. I know it's frustrating for me, and I know that it's probably frustrating for you guys as well. There. So, let me show you the web training. And currently you do not see my screen, correct?
Correct.
So on this screen, Manat is a legal firm, but they specialize in the litigation that's going on with Mapia. And I'm going to put this link in the chat. I signed up to take this webinar. So if anyone wants to take it, they're going to talk about the latest trends, what's coming up. It is next week on the 26th, and here's how to register. So I will put that in the chat so everyone can, if you're interested, can sign up to participate in that. And then the other thing that's very exciting, and some of you may have heard about this as well. So in the federally, right now, there's legislation in Washington for the Social Work Compact, and it includes counseling as well, which would impact network adequacy, because if someone in these dark blue states like Washington State has legislation, Missouri. So if I'm licensed in Missouri, that means Washington would also give me reciprocity, and I could also do counseling and therapy in Washington. It's going to be, because for social work, it's a national test, so we all take the same test. This would help improve the shortages and access to care and the wait times that we're seeing. The light blue states, Arizona's is one of the light blue states, so we do have legislation pending. It is SB 1036 that is going through the House right now, which is very exciting. So it passed in the Senate, it's going through the House. And we hope it gets the support and we can get it through. And then we will be able to accept reciprocity from the other dark blue states. I don't know if everyone's aware, California and Arizona are the two hardest states to get, it's not called reciprocity, but that's the word we'll use. So if I'm licensed in Michigan and I try to get licensed and I move to Arizona, I try to get licensed in Arizona, it is really difficult because they don't recognize like the classwork, and different states obviously have different standards. Arizona and California have the highest. And so it is very difficult to get licensed here. But if I go to Michigan and want to get licensed, it's not as difficult. I don't have to retake the test or things like that. I can just pay a fee and Michigan will recognize my licensure here in Arizona. So this is exciting news. Hopefully we will get all the states to sign on so we can reduce the shortages that we have. I don't know if anyone has any questions on that. It's a call to action. So if you want to reach out to your representatives to say pass it, that would help the cause. So any questions about the social work compact? Okay. That might be, that is everything. Do we have any ideas, topics anyone wants to open up for future topics for the next meeting?
I was just going to share, excuse me, I had the opportunity to go to the NAIC meeting last weekend in the Mental Health Parity Committee. I thought the presentations at that committee were really interesting. In particular, the guy who explained the difference between medications, used for treatment of opioid use disorder. It was such a great presentation. It helped me understand things in a way that I had not previously understood it. And kind of how it would play into a, parity perspective. If you have a drug that's used to treat both addiction and pain, and if you pre-cert it for one, but you don't, one diagnosis, but you don't pre-cert it for the other. Anyway, it was just a very interesting presentation. So that might be something that would be worth sharing with others during this meeting.
Sorry, I would say, in addition to the social worker compact, there's also a counselor compact that's moving
Yes.
the legislature. So that's similar.
Mm-hmm. Very similar. I know that the council one started first, and so as it got traction, that's when the NASW put forth the legislation for the social work one. So hopefully, both forces together we can get it through over the finish line and be successful, because we know that the care is needed and that there is a shortage. So it's very exciting. Fingers crossed.
Going back to Vista's point, if I can, Dr. Hennigan,
Yes.
I agree. I think that the presentations from that meeting were wonderful. I also found it maybe a topic of future discussion that there are certain drugs needed for proper mental health care that unfortunately do not have generic equivalents. And then, it turned out to be something that's out of reach for some people. Certainly something to look into as well. I know there's a lot of discussion, but I think that as efforts continue, and as perhaps, I believe there's an open comment period on some new rules too down the road. So I think that any ideas for conversations that we could perhaps research and collaborate and think about would be a good idea. But I think that Vista's right on. I think that is a very important topic.
I agree. And if we could, I think it's also, it'd be good to educate. That's a good public education, because when you go to the doctor, you don't know that there's not a generic, or you may not know to ask for the generic in some cases, and how to navigate that if there's not the generic and you can't afford it. How do we help consumers navigate that and still get the appropriate medication that they need in there, so their mental health is not compromised? So I think that is a great topic that we could talk about in the future. I'll put it on the May agenda.
And for your network, the communications out to consumers and whatnot, I know that the department now has someone who's going to be assisting greatly with you, Dr. Hennigan, and the work group that's doing that. That would be a good campaign, as they call it, to, did you know, whatnot. I think that many times people are afraid to ask those hard questions, particularly when it has to do with mental health. So I think that we could be good stewards to the Arizona consumers by providing that information in a manner that it is, they don't have to reach out to ask for it. They have it there. So that's a good something to add to the list for perhaps the communications.
Okay. Also, too, in May, we are going to do we usually do a campaign in May for Mental Health Awareness Month. If anyone from the public or anyone on the committee, if you have any activities that are happening or you're doing anything, we'd definitely like to help support that and get that information out. Or if we need to like retweet it or things like that, send that information over to me, because we definitely want to get the word out and have a really strong campaign for May to get the word out about mental health awareness and how people can get resources and help and everything that falls under that umbrella. So if you have any information or resources that you want to share, please get those to me. Probably by the mid-April, if you could, so we can get it out to our communications team. Any other topics or questions?
Do you have a rough estimate of when you think you might have this round of reviews wrapped up and ready to share with the industry?
Vista, I'm starting to get my bearings a little bit better. So I'm hoping, there's cross. I would like to be done by June. I'm kind of finding my rhythm. And I'm able to like hone in on certain things. June at the latest, very latest July. So that is what I'd like. And when we're reaching out to each one, when we start a person's review, a specific a carrier, we're reaching out saying, hey, we're starting your review this week, just so you know that, to have it on your radar.
Okay.
Any other questions, comments? I hope everyone's March Madness bracket is already busted. Okay, our next meeting is May 17th at noon. And if I know that when we first started the committee, I'll just put that out there. We picked Friday, but if Friday is no longer a good day and we need to look at a different day of the week, I'm open to that. We're not locked in on Friday. I just want to make sure we can get maximum participation. So if you have any feedback around the day, if Fridays are now not a good day, just please send me an email and we can also put that on the May agenda to see if we just need to do a different day. I know Fridays are rough because people go out of town and especially as we're coming into summer. So if we need to switch it up for the next couple months, we're okay. We can do that. We have that flexibility.
Thank you.
Okay. Well, I hope everyone has a fantastic weekend. And like as usual, if you need anything or think of something, don't hesitate to reach out, and we will see you guys in May.
Thank you.
Thank you.
Thank you.
Thank you, everyone. Bye-bye.
Bye.